the presentation.
Hey, hello everyone. Can you hear me? All right, I think so.
Yes, we can.
Okay, awesome. Hi, I'm Johnston. I'm going to be briefly discussing the background of the overdose crisis in BC and Canada. So next slide, please. All right, so as you may be familiar with, the overdose crisis these days, at least in North America, is driven by the increasing toxicity of the drug supply. Namely, fentanyl and its derivatives are showing up in all sorts of different types of drugs, severely increasing the risk of an opioid poisoning. This is a big issue because not only are you at risk of opioid overdose when someone uses opioids, but also when they use any other drug as well. In BC, the overdose crisis has recently gotten some attention last month as several high-profile youth overdoses occurred. The month before, BC also commemorated the 5th anniversary of the overdose crisis, as well as a grim milestone of 7,000 total illicit drug toxicity deaths in the province since 2016. Next slide, please. All right, one thing to note though, is that the main demographic affected by the crisis is not youth. By youth, we mean teenagers, but also young people in general, which includes people in their 20s. In BC, 70% of illicit drug toxicity deaths were individuals between the ages of 30 and 59. 79% of deaths were males. This chart you see before you breaks down illicit drug toxicity deaths by age group, with people under the age of 19 and between 19 and 29 represented in the lower two columns. In BC, people under the age of 30 make up only 16% of illicit drug toxicity deaths, and people under 19 only 1%. You'll also notice that the proportion of deaths from these two age groups are on the decline. Next slide, please. This is similar when you look at the national statistics. Youth make up a relatively small portion of overdose deaths, especially youth under the age of 19. With that being said, if youth make up such a small portion, then why do we still need to focus on the crisis in youth? Well, just because something is less worse than others doesn't mean we can just brush it off. It is also beneficial to intervene at an earlier age rather than later in life. While services for adults are often abundant and the main focus of much of the overdose crisis response, young people continue to face many barriers that prevent them from seeking help. I'll pass it off to Pravleen.
Yeah, hi everyone. My name is Pravleen. I hope everyone can hear me. And I'll be discussing why it's important to be addressing youth during the opioid crisis. Next slide, please. So I'll be starting off with some statistics. In Canada, youth aged 15 to 24 had the fastest increasing rate of hospitalizations due to opioid poisonings between 2007 and 2015. Youth and young adults also comprise 20% of opioid-related deaths. These statistics alone make it evident that it is important to address youth. And now let's move on to why youth need tailored treatment. Next slide. Youth using opioids have special needs different from those of adults, and as such, it is crucial to adopt tailored treatment instead of a one-size-fits-all approach. Youth substance use patterns differ from that of adults because of challenges that are more common in youth, including peer pressure, identity challenges, high academic expectations, family issues, and self-confidence issues. Mental health and substance use disorders are also more common in youth than any other age group in Canada. Moreover, youth are more likely to take risks while using opioids and use them impulsively or out of curiosity with disregard for the following consequences. The services available for young people must be able to effectively address all of these factors that are specific to youth. Next slide. Now, another reason why it's important to address youth is a lack of understanding of the dangers that come with prescribed opioids. Many youth who begin to use stronger non-prescribed opioids such as heroin and FentaNIL initiate their opioid use with prescribed medications. A study on youth aged 14 to 24 shows that youth generally consider prescribed medication to be safer than non-prescribed medication, and that addiction risk with non-prescribed medication is higher. There's a significantly smaller portion of youth that believes prescribed medication also has the potential to be unsafe. The belief that prescribed medication have lower addiction risk may be a result of having an incomplete understanding of the risks associated with opioid use, both prescribed and non-prescribed. The belief that prescribed medication is safer stems from trust in doctors and that they would prescribe medication in controlled doses depending on the patient's needs. Youth also use opioids non-medically, which involves use of multiple substances, future risk of opioid use disorders, and overdose. Opioids are also readily available to youth, whether it be taking them from a friend who is overprescribed opioids, or perhaps obtaining them illicitly from individuals who might be selling them. The lack of understanding of the risks associated with opioid use, coupled with easy accessibility, make youth more prone to opioid addiction. Overall, youth consider the source of the drug and relate that to the risk of addiction and overdose instead of considering the contents of the substance itself and then assessing the risks associated with it, which is another reason why it is necessary to raise awareness among youth. Next slide. The COVID-19 pandemic also brings its own challenges for young adults and youth. Although less exposure to peers due to the pandemic could result in less access to opioids and increased emotional support due to spending time with family, the COVID-19 pandemic also brings mental health strain, isolation, and stress with it, which puts youth at an even greater risk for using opioids non-medically, opioid use disorders, and overdoses. Mortality risk can increase due to social isolation, as individuals using opioids alone have nobody to call emergency services in case they overdose. Other conditions that may amplify the severity of the situation is that in some familial contexts, adolescents may become more vulnerable due to family stress or perhaps domestic violence, which only increases the risk for non-medical opioid use during this pandemic. Increased risk for youth could be a result of increased access through family, as individuals may simply take opioids from a family member with a prescription. Overall, the pandemic and social isolation in youth presents even more unique obstacles when it comes to addressing the opioid crisis among young adults and teenagers. Next slide. Moving on, there has been a steady increase in opioid poisonings amongst youth as well. Hospitalizations due to opioid poisoning among youth had the greatest increase in rate between 2007 and 2015, with a 62% increase going from 6.5 per 100,000 hospitalizations to 10.4 per 100,000. And in 2019, individuals of ages 29 and younger had the second highest rate of opioid-related overdoses and hospitalizations due to opioid poisonings. Accidental opioid poisonings made up the highest portion of the total hospitalizations in Canada during this time period, and is usually a result of medication not being taken according to directions, making it clear that young adults may need additional guidance that teaches them how to use opioids. Opioid poisoning hospitalizations among children under 15 were mostly accidental, but youth between the ages of 15 to 24 were hospitalized due to intentional poisonings. It is important not only to increase prevention efforts for harm reduction, such as safer storage of opioids to avoid accidental poisonings, but also getting to the root of the issue and educating youth about safer use of prescribed opioids. Which brings me to past government action taken to address the crisis amongst youth. Next slide. The federal government's action does not involve significant youth-specific action. However, they have made investments that could be indirectly beneficial for youth. For example, they made a $20 million investment for organizations with the goal of providing more training in response to opioid overdoses and increasing access to naloxone, and a $500 million investment for healthcare to help individuals facing substance use and mental health issues or homelessness. Now, this is beneficial to the general population, which includes youth, but it does not target other youth-specific issues, such as opioid use due to peer pressure or academic expectations. Again, the one-size-fits-all approach taken by the government is not the most effective way to target the overdose crisis amongst youth. The BC provincial government does have educational information for adults on how to talk to youth, overdose prevention information, and links to youth resources, but not enough direct action to target the young adult demographic. There's still much work to do to address youth, as many adolescents and young adults may not be entirely sure of the risk of taking opioids, prescribed and non-prescribed alike. Now I'll pass it on to Johnston.
Hello again. I'm going to be discussing some of the unique challenges when it comes to addressing youth overdoses. Next slide,
Oh,
please.
Johnston, we're having a little bit of an issue with your mic.
Can you hear me all right now?
It's a little bit better.
Okay. How about now?
That's good.
Okay, nice. I'll try to speak as loud as I can, but I can definitely see my microphone is having some issues. All right, next slide. All right, before I start looking at the challenges, we should probably review why youth use drugs in the first place. The Canadian Mental Health Association breaks it down into 4 categories. The first, to feel good, which provides self-confidence, relaxation, and satisfaction. Second, to feel better, reducing anxiety or stress, often connected to trauma or depression. Third, to do better, enhancing performance. And fourth, out of curiosity. You can imagine that given the immense diversity in youth upbringing and environments, that youth who use drugs have unique combinations of these 4 factors. Next slide, please. The first challenge is with neurodevelopment. As you may know, the brain is still developing throughout adolescence through molding and maturation. Adolescence extends from around 12 years of age to your early 20s, and during this time, youth are especially susceptible to risk-related injuries, including those involving substance use. During this time of critical brain development, 2 things are generally evident: impulsive and risky decision-making, and heightened emotional reactivity and sensitivity. Risky decision-making contributes to addiction by increasing the likelihood that youth use drugs for the first time, and also ties in with the curiosity reason from the slide before. Meanwhile, emotional reactivity ties in with to feel good and to feel better, as young people may not only feel more inclined to pursue positive emotions, but also escape negative ones. One thing I want to make clear, though, is that these are generalizations and are highly dependent on the individual as well as their circumstances. What I've noticed is that youth insights and abilities are frequently dismissed by adults under the argument that, oh, they're just a kid. But youth have been shown to be capable of analytical reasoning and risk assessment comparable to those of adults. So when I say youth tend to make risky decisions and react more emotionally, these are contributing factors that may be present in youth to a higher degree than adults. Next slide, please. All right. Sorry about my microphone. I don't know what's going on. Better? Okay, I'll switch over to my headphones so hopefully people can hear me a little better. Give me a second. Okay, hello? Hello? How's this? Oh my goodness.
There's an echo from your end.
What about now?
Better.
Okay, awesome. Okay, right. So on to the second group of factors. Adolescence is a pretty unique time in the course of an individual's life. During this time, youth acquire skills for independent living and begin taking greater risks. This is not necessarily a bad thing, because risk-taking can promote personal growth, and from an evolutionary perspective, may even be necessary. This brings me to the environment that youth find themselves during adolescence. During this time, peers overtake family as the most important part of an adolescent's network. This means that peer pressure can easily take a hold and cause youth to use drugs for the first time. This move away from a young person's parents is also in many cases the result of a drive for independence, which can also be a factor in causing substance use. On top of all this, mental health is a big factor at this age, as youth begin to encounter the challenges of adult life and start entering the workforce or post-secondary. Childhood trauma has also been demonstrated to contribute to substance use, as well as an increased risk of addiction. Next slide, please. Now for what I think is one of the more easily addressable, but still very substantial challenges, which is the barriers that youth face when they try to receive treatment or care. First of all, information about youth services is not easy to come by. This may be because the services currently offered are often not linear. Where someone may be referred to is dependent on their goals, the degree that they are affected, as well as much more. But on top of that, youth are having difficulty navigating the treatment landscape. In a survey conducted by the BC Representative for Children and Youth, 68% of youth respondents noted that they did not know where to go to find help. Additionally, stigma continues to be a prevalent factor that prevents many youth from accessing treatments. Stigma is certainly not unique to youth, but stigma from parents or guardians, friends, teachers, and more may continue to be a barrier. To break down this barrier, we need to address stigma not only among youth, but in the people around them. Next is physical inaccessibility. This can take a lot of forms. For example, youth in rural areas and what are considered safer neighborhoods continue to have difficulty accessing services. The centralization of many services in areas such as Vancouver's downtown east side contributes to this. As well, wait times, no matter how little, can be a barrier, especially due to personal circumstances such as homelessness. In 2016, the BC representative for children and youth found that some service providers were even unable to report an approximate wait time because their wait times varied so much. Wait times at providers across the province range from no wait to 3 months. And finally, but not least, many providers are not tailored to the unique needs of some youth. And this includes youth with concurrent disorders, pregnant or parenting teens, LGBTQ+ youth, and First Nations youth. These groups are often not provided with sufficient supports and even continue to face discrimination to this day, which dissuades many from seeking treatment as a result. The main takeaway here is that there are lots of challenges that youth face that contribute to opioid poisonings, and that if we want to effectively address the overdose crisis in youth, we have to start with these challenges. Addressing some of the challenges here not only involves addressing youth, but the people around them, whether that be parents, service providers, and more. Now to pass it off to Azra.
Okay, so next we'll look at some strategies to address how youth are impacted in the overdose crisis, and we'll look at this on a few different scales. So first of all, developing effective and evidence-based educational programs could be a way that schools and other institutions address how youth are impacted by the overdose crisis. Effective educational programs would need to address the environmental and social factors, which Johnson mentioned, which are correlated with that increased risk of substance use and addiction in youth. The focus could be on building healthy coping strategies for stressors or other life circumstances so that youth don't feel that substance use is the only way to cope with negative feelings, as an example. These can also focus on building self-esteem or other positive attributes. Additionally, existing programs which are effective have different goals when targeting different age groups. So in younger students, the target could be to delay or to prevent drug use, but the goals will need to shift based on the age and experiences of each group of students. So for example, in adolescents, many of them may have started to experiment with substances, and as such, the focus should shift from prevention to harm reduction and to safe substance use. The emphasis should be on how people and youth, especially who are using drugs, can be safe while they do so. Evidence demonstrates that programs which aim to scare or instill fear about drugs in students are way less effective than programs aiming to purely educate them. And there's lots of evidence like that the drug education programs like DARE, the Drug Abuse Resistance Education Program, which aims to promote abstinence and instill fear, are not effective, even though they have been widely used. Educational programs in schools have the potential to be effective, but when programs are implemented, they are unfortunately not evenly or equitably distributed. So schools in certain locations may be more able or likely to host educational programs or may have better quality programs. And access to these programs can differ based on the rural versus urban location of schools, socioeconomic status, and public versus private schools, for example. For equitable access, there would need to be an increased emphasis on reaching rural communities, people who are homeschooled or attending school online, etc. Additionally, when we look at access to services in BC, which are available for youth, it's super complicated to navigate, and there's a lot of uncertainty regarding the age restrictions or whether adult services have the training or education to help youth. Many safe consumption sites, for example, have restrictions for youth who can access them. So in BC, people who are under 16 or people who are under 19, but it's their first time using substances, may not be eligible to access and use a safe consumption site. So as a result, youth may not be able to find or access relevant services. And if they do gain access to service, they may not get the support that they need. Families and youth have difficulty accessing information about available services, and which they're eligible to receive. So one way to alleviate this problem would be to implement a centralized entry point to services Ideally, this should be easy for youth and their families to access, and it should clearly outline the barriers to accessing each of these services. So these barriers can include cost, location, timing of the services, etc., and it should include how services are working to overcome these barriers. Additionally, some of the same strategies can be used for both youth and adults, and this could include implementing a safe supply and the decriminalization of substances. With the toxicity of the illicit drug supply, many people, regardless of their age or previous drug use, are accidentally overdosing. So a regulated and a safe supply would provide people with the information that they need to make informed decisions about their substance use. Now I'll pass it off to Samara.
Hi, everyone, and thank you, Azra, for that. So now that my colleagues have discussed the importance of addressing how youth are impacted by the overdose crisis and strategies we can use in this important endeavor, we also want to take the time to highlight just a few organizations that are currently serving youth and are focused on the overdose crisis, other than the FentaNIL Project, which Azra has already explained. Of course, there are many groups across Canada fighting for these same goals, but we just want to highlight a few of them today. Azra, can you switch slides? So first we have Naloxone, which is based here in BC. This organization was started by a student at SFU. She was inspired to start the group after witnessing an individual suffering from an overdose during her commute and using naloxone to provide life-saving support. The group is led by youth ages 18 to 25, and their main focus is running educational sessions in secondary schools. So they offer evidence-based advice and have a strong emphasis on destigmatization in their education programs. The next group we have is the Canadian Students for Sensible Drug Policy, also known as the CSSDP. This group is formed by youth and students who are concerned about the negative impacts of certain drug policies on individuals and communities. So they consider drug use a health and human rights issue first, rather than a criminal or legal issue. And their work involves education for young people, advocacy for harm reduction responses, and support of harm reduction legislation. Then we'll move on to the Liam Project. This is a group that was founded by 3 students from the University of Calgary after their friend Liam fatally overdosed in 2019. They used their platform to honor his memory by advocating for harm reduction and offering education for safer drug use. So they target individuals aged 15 to 25, which is a group that's becoming increasingly more affected by overdoses in Alberta. And with their social media campaigns, they aim to destigmatize drug use and connect community members with accessible resources. And the last group we want to highlight today is the UBC Student Recovery Community, which is actually a group that's also collaborating for this conference with the ACD Research Group. The first of its kind in Canada, the UBC Student Recovery Community was started by a UBC student who struggled with alcohol use but could not find support groups with youth members that she felt she could relate to. So along with support groups, this community helps students in recovery navigate the stigma and triggers that they may face on campus. And they're trying to specifically target the need for gender-specific, age-appropriate, and culturally safe services for women, people in the LGBTQ+ community, and youth. With that, we first want to say thank you for listening to this first part of our presentation, the first half of the workshop. And we're now going to be moving into breakout rooms. Azra, if you could switch slides. So what we were going to do for the second half of the workshop is going to be putting you into breakout rooms of approximately 10 people each. And we have a worksheet for you all to work on. And this includes an activity that you have the opportunity to discuss with your group members. And then you also have an opportunity to share this at the end when we bring you back from the breakout rooms. And we also have some discussion questions that you can choose to use to guide your activity, or you can choose to fill the time with. So I'm going to be sending the link to